Welcome to Alpha Bites, where we serve up bite-sized insights to help you grow your business and your bank account. Our host, Alex Zinni, CEO of Alpha Key Digital, dives into the latest marketing trends, proven strategies, and actionable tips to scale your online presence. Whether you're a seasoned entrepreneur or just starting out, Alpha Bites delivers the keys to unlocking your success. Now, let's get started with the show.
Hi, everybody. I'm Alex Zinni, your host of Alpha Bites, where I sit down with business leaders and entrepreneurs to learn more about what makes them tick and to learn from their success. Past guests include Bill and Ryan Streb of Streb Electric. And what we do is we dive in to, like I said, what makes entrepreneurs, business leaders, people who are very influential in our business community, what makes them tick. So this is our first season, so stay tuned for more great episodes. This episode is brought to you by Alpha Key Digital. Located in the vibrant heart of Northeast Ohio, Alpha Key Digital delivers revenue-generating digital marketing solutions tailored to plastic surgeons, roofing companies, physical therapists, small and large business. From cutting-edge SEO and social media strategies to high-performing websites and pay-per-click campaigns, our expert team is committed to driving measurable results that elevate your brand. Whether you're a local business striving to dominate your market or a national brand seeking a competitive edge, our comprehensive suite of services ensures success in today's very crowded digital marketing landscape. So to unlock your business's full potential, please visit our website at alphakeydigital.com/contact us to book an introductory call. Listen, I'm here today with Cara Ogren, Dr. Cara Ogren of Synergy Physical Therapy and Wellness. Dr. Cara is a physical therapist who embarked upon clinic ownership 17 years ago, after opening her first practice in her hometown of Ashtabula, Ohio. Since then, she has grown to 3 locations and has sold her practice to a partnership company based out of Chicago. She's now embarking on a new chapter in her professional career with opportunities for expanding her professional network, deepening her skill set in the women's health arena, and learning more about how corporate medicine can enhance small businesses that serve both underserved communities and those in urban areas. Welcome, Dr. Cara Ogren, to the podcast. Good to see you.
Hi, Alex. Thanks for having me.
Absolutely a pleasure. It's been a great honor getting to know you throughout the years, and I wanted to have a formal sit down where we can bring you to the world and learn more about you. So, if you could just tell us a little bit about what you do.
Yeah, thanks, Alex. So I became a physical therapist about 24 years ago. I graduated in 2000, so I'm going on my 25th year this year. And if you hear the little whining in the background, we are doing some therapy dog training in my office. We have always had therapy dogs at Synergy as just a way to control a little bit of a high stress population, allow people to kind of relax into our setting. So he's on day 2 of training. So I became a physical therapist right at the beginning of a shift, I think, toward women's healthcare, where we started to really have a bit more evidence to show us how certain treatments were more effective than others, and how more cutting edge treatments maybe could have a new space in our treatment setup for patients. And so physical therapy has really gone through some big changes in the past 25 years, and it's been really exciting to be a part of that. I haven't always been in the outpatient realm, but that's my sweet spot. So when I moved back to my hometown of Ashtabula about 18 years ago or so now. I guess it's hard to think of time passing this fast. But I moved back to my hometown, and really I was excited about working in, a cool clinic where I could really dig into my skill set. And I was very passionate. I've always been very passionate about PT-driven care and high-skilled interventions. And when I came back to Northeastern Ohio, I was kind of surprised that there weren't any women's health practices that were able to really deliver the kind of care that I thought was really appropriate for women with conditions that disproportionately affect them. And so when I couldn't find any clinics that I really fit into, I just figured I would build my own. And I've been very fortunate to see that practice grow.
Hmm. Yeah. So you identified that need. So where were you coming from, Cara, that you moved back home?
So I moved all over the place. When I got out of school, I took a job just outside of Detroit, Michigan. And I think, like all people who have a lot of school debt, at the time I had nothing but energy to throw at the problem of a lot of school debt. So I had 3 jobs most of the time. I worked in the outpatient world, I worked in home care, I worked in acute care, all kind of jobs layered on top of each other just to kind of make ends meet. Um, and as any other physical therapists out there know, the late 90s were a hard time for reimbursement. So PTs were losing their jobs. Nobody was hiring us. And so wages went down significantly. So it really took 2 or 3 jobs just to make a living. So I started in Detroit, moved back to Ohio for about a year, but that was more down in the Canton area. And then decided that I wanted to travel. So I became a traveling therapist and moved down to Georgia and then moved up to Delaware, moved to Boston in the meantime, somewhere in the mix there. I can't remember where Boston happened. And then I settled into a position out of Baltimore. And that allowed me to travel to a tri-state area because Baltimore is kind of close to the Philly area and downstate Delaware and the DC area. So I had a job that took me to a few different states. And that job is actually where I learned how to run businesses.
Mhm.
So,
Yeah, because running a business and being a physical therapist are two very different domains, right?
yeah,
So
yeah, totally different.
what was the moment when you said, okay, like I can do this and I'm going to start my own practice? What was that like coming to that decision?
Yeah, I started to see how I could do it when I worked for this company, wonderful company called Rehab Dynamics based out of Wilmington, Delaware. And that company is owned by a business guy,
Mhm.
but he owns hotels, restaurants, and nursing homes.
Mm.
And the nursing home is the outlier, right? Like,
Mm.
why would he own nursing homes? But when you got to know Steve Silver, you started to realize that that was his passion. The restaurants and the hotels, that was what he was making money on. But his mom ended up getting really good healthcare in a nursing home. And he felt really moved by that experience. And so what he would do is he would go into failing nursing homes. He would buy that nursing home. He would gut the building, clean out the staff that was ineffective or, kind of dragging the business down. And he would restaff it with high level staff, rebuild the facility, and he would own and run that place like the most impeccably run nursing home ever. And that was what he gave back to the community.
Wow.
So I learned how to run diverse businesses to support your passion. So that was, when I entered into some boardrooms as a 24-year-old and I had no business being in that job. I had no business experience, but Steve Silver gave me an opportunity. And he said, if you want to learn how to do this, then just pay attention,
Hmm.
start listening, get into these boardrooms with me. Don't make any comments. He didn't trust me in the beginning. I really had to earn my keep. And he taught me how to run a diverse business so that you can still do your passion projects, but make ends meet. And you
Hmm.
can employ people and you can give them good jobs with good wages and good benefits, despite reimbursement models kind
Hmm.
of discouraging that, to be honest with you. Healthcare is a very challenging reimbursement model.
Hmm.
So I owe all that business acumen really to him because we don't learn these concepts in PT school.
Right. Well, and you said that you had no business in being there, but obviously he saw something in you that was very promising, and look where you are now.
Yeah.
3 locations, Northeast Ohio, and for the listeners who aren't from Ohio, Ashtabula is roughly about 40 minutes, 45 minutes east of Cleveland. But Synergy Physical Therapy, Dr. Cara's practice, she has a wide range of locations, 3 locations, and 3 very busy, nice hubs in Northeast Ohio. How was it that when did you make the decision to scale? Did you start with 3 locations or did you start with 1 and grow? How did that come about?
I started with the Ashtabula location, but very, very quickly, just based on my training with rehab dynamics, I knew that I would scale if I wanted to serve an underserved population like Ashtabula. So I knew that I needed to be in a different demographic, different county, different per capita income, per household income. So for that area, I specifically went to Berea next because the per household income was different and the demographics were entirely different. So that when there's always seasonal shifts in, medical practice. So when my business slows down here in a certain season, it's up in my other office. And they kind of work in tandem so that the company as a whole never really sees much dipping. And just the difference in patient population allows the company to be a little bit insulated from changes that happen in payer models. Like I have a lot of patients here in the Ashtabula location that have Medicare, but most of my patients in the Berea and Willoughby locations have private insurance. And so when Medicare cuts our reimbursement, but Anthem might increase some of our reimbursement in some patient models, we kind of also are a little bit sheltered from those declines in reimbursement. So, I really quickly knew that I wanted to expand, and I just waited for my patients to show me where I needed to expand to. So I was getting a lot of patients from the Cleveland area coming out to see me in Ashtabula. And when I looked for outpatient pelvic therapy in, the Cleveland suburbs, I really saw none. There still to this day are none, really, except for where we are. I was like, okay, here's the second office. It just kind of needed to appear.
And how long was it from, when you opened your Ashtabula office to opening that Berea location?
It was about, oh gosh, this is going back a little ways. I think it was about 2.5 years, give or take.
Nice.
Yeah.
And then was that something that you were nervous about expanding, or was it something that you confidently just said, we're doing this, and you did it?
Petrified, right? And I had no business expanding into a second location, but I had all these patients coming from Cleveland. So again, just by the grace of whoever you believe is in control of all of this, I found a building owned by a guy who used to own Lube Stop.
Okay.
Bob Frost, just another angel in the world. Bob Frost is a multimillionaire. He owned this building in Berea, and they used to have a PT clinic on the first floor. I sat down at a huge conference table with Bob, and I said, listen, I have no money, but I have so much ambition and I have so much drive, and I know that I can make the second location work. And he said, well, that's good because I don't need any money. So I've got this empty space, and he gave me that property for like no rent for the first year or two. And he said, listen, if you can make a go of this, then we'll talk about a real lease with like an actual rent payment. But he said, for the first, I think it was 2 years, he gave me practically free rent. And he just said, go for it. If you can make this work, then we'll do things differently. But still, that 2-year mark that he that 2-year time frame that he gave me to just grow allowed me to afford the equipment that I would have otherwise had to take a loan out for. I started that second location loan free, which has always been important to me as a business owner. If I take out a 10-year business loan, I pay it off in 3 years. If I take out a 5-year loan, I pay it off in 90 days, or, in 5-year, wait a minute. I always do this like half, like I cut my loan time in half.
Smart.
So I try and get to be debt free as quick as I can. So that second location was just like pure, I don't know, luck, I think. And just being willing to sit down with people at a table and say, trust me, I can do this.
And they do.
I had no idea if I could do it. Yeah,
exactly. But you have enough confidence, but then you also demonstrate obviously a lot of competence too, which people picked up on. And that's amazing. And then I want to talk about something in particular. I know you have a focus in women's health. So kind of walk me through how you initially became interested in providing care for women's health in particular.
Yeah, I mean, I started to understand what physical therapists did at a very young age. My grandma was like my best friend and someone I spent a ton of time with when I was very young. And when she got sick, she had all these medical practitioners in her world. She had oncologists and she had surgeons, and it really just didn't seem like anybody was able to help her except for her physical therapist. And that was what my, 9-year-old brain understood. Now, looking back on it, I'm sure her doctors did a very good job. I'm sure her oncologist really did excellent care. But what I saw as her granddaughter was someone, her physical therapist helped her get her pride back, helped her get her sense of self back because she could dress herself and move around without needing help. And that was something that was a deep source of pride for my grandma. So while I was growing up in those formative years, I was like, that's it. I want to help grandmas all day long. That's what I want to do. And so that started my passion in the physical therapy world. And I just started to volunteer all through junior high and high school. I was like an institution at the local clinic, hospital, and there was this outpatient clinic that I transitioned to later in my high school career. And I would just show up after work or practice, and I would just be there and just absorbing all of what they did. But my passion for women's health has gone back to my grandma for sure. Like every person I treat is kind of a testimony to her.
That's beautiful. And that sense of purpose that you get, is, I'm sure, extremely fulfilling to do that. What's one of the biggest changes that you've seen in an approach to women's health, whether it's discoveries, new ways of treating people? Is it less taboo? Like, if you could pinpoint, what's one major change you've seen since you were that 9-year-old to now in women's health treatment?
So the biggest paradigm shift that I think has happened is self-directed care, is, patient autonomy. Most of my patients refer themselves to therapy. I really enjoy, and I seek out opportunities to collaborate with other healthcare providers like urogynecology surgeons and gynecologists and oncologists, and especially in the urology world. But I think the biggest shift has happened as we have empowered women to direct their own care. Because most patients with injuries, they do have a sense of what they need. They do have a knowledge of what their body needs to heal. And so allowing people to access care directly without needing that referral and that gatekeeping mechanism that's been removed from the physical therapy realm has been such a game changer for my women especially, but truly for all of our patients. But yeah, but more in the women's health realm especially. So we're the ones often diagnosing these problems. And so we're becoming an assistance mechanism for their primary care physician, who's just not equipped to do some of the pelvic exams that we are, nor do they have the time to do that. So they rely on us to do the more in-depth testing that we have the time to do. Our assessments are at least 60 minutes and sometimes longer. That gives us just more time than the average primary care physician.
Yeah, and that's a trend that I think we're seeing across the board is self-directed care, and opting for more, even for lack of a better term, holistic or less surgical, less drug driven approaches for people. And when you sit down with a new patient, how do you? Because I imagine that some people don't feel empowered enough to make their own decisions, and they're looking for an authority figure to tell them exactly what to do. How do you balance that, approach of self-directed care, but then also knowing exactly what needs to be done and letting them know?
Yeah, I prepare patients for what I call the blind faith phase of physical therapy.
Mhm.
That you're right. Most people have an inkling of what is wrong, but they have no idea how to fix, for lack of a better term, even though we're really not fixing as much as they're fixing. We're just teaching them how to heal their bodies in a lot of ways. But I prepare people for a blind faith part of this process where they just have to trust that we are not going to mislead them. And if at any point we feel like we're on the wrong track, that they should feel 1000% comfortable with telling us, because their gut is going to be very powerful as a means of pulling them through this treatment plan that requires just a lot of cooperation and a lot of teamwork. Which is why my company's name is Synergy. There's just so much teamwork involved in what we do in the pelvic health world. So that blind faith phase only lasts so long. Once we start to educate patients on the mechanisms of their injury, then they start to really understand how the treatment progresses. And then by the time really we're done with them as a patient, we've taught them everything we know about human physiology as it pertains to their injury, so that they can be good custodians of their body as they go through the aging process. Mm-hmm. And when re-injuries appear, if they do appear, then they have a really good sense of when to call us again or when to go see maybe a different specialist, So we prepare them with the right information.
Yeah, it sounds like just what a great mix of empowering and educating and being there with your patients. You touched upon coming up with the name Synergy. How quickly was it that it came to you? Did you put a lot of thought into it? What's the story of the name Synergy, physical therapy and wellness?
Yeah, I really just wanted to embody what the teamwork aspect could be between a practitioner and a patient. And there's this thing in the physical therapy world when people open their own practices, therapists have this thing where they want to name their clinic after themselves, like Ogren Physical Therapy. But again, it just didn't encompass what I felt the essence of my practice should be, which was not about me. It's really about the patient. And there's always a legacy that I wanted to create. So Ogren Physical Therapy doesn't mean anything when we end up partnering with another group, for example, how we just sold our practice so that we can continue to grow. So I wanted it to be about more than myself, but I have to tell you a funny story. When I shared my my company plans with my family, my grandmother, who lived to be 99, and she was a very smart lady, she looked at me and she said, "Did you just make up that name?" She really thought I made up the word synergy. And I said, no, Grandma, you have to look it up. Yeah, it's actually like an actual term. It actually means something. And she was like, "No, you just made that up. It just sounds good." So half of my family to this day, I think, believes that I made up the name synergy and that it's not a real term, but it's actually a real mathematical term. It's essentially the definition is 2 + 2 = 5 in the synergistic term of the world.
Mm-hmm. Yes, that X factor, that extra variable that enters when you get traction,
Right.
really brings. And Grandma was right; it is a great name, and it is catchy.
Yeah. Yeah.
That's really cool. And that kind of leads me to my next question. Then, what do you think gave you the most traction in building your business throughout the years? Is there anything you can say that was like that really gave you the most traction?
Reputation, right? Integrity and reputation. Do what you say you're going to do, follow through with what you're promising, be it to your patients, be it to providers that refer patients to you, be it to the landlord that you rent from, or the building owner if you're building your own structures, your own buildings, which I would love to do someday. Yeah, integrity. That's it. You have nothing else but your reputation when you're really embarking upon your own practice. And I think that's a common thread with small business owners, especially those of us who started from nothing, is that we want our reputation to stay top tier. And in the beginning, that's all you've got. That's really all you've got. You can't buy patients, you can't buy customers, they've got to come to you willingly in this type of arena.
Yeah. Yeah, that's a great reminder too. It takes years to build a reputation, but it can only take minutes to tarnish one. So it's a great reminder to remember to keep that integrity at the forefront and to deliver great results and be honest. Honest is a big one.
Exactly. Especially when you can't maybe meet the expectations of your customer, which for us is a patient, and being transparent about the fact that, I had that conversation with the patient this morning that, I don't think I can get you 100%, but I can get you 90. Yeah, I can get you most of the way there, but in some cases, there's too much joint damage. There's too much permanent structural change in the body to really get 100%. And most people can absorb that. I think if you treat people like adults, like they are, most people really respect that. And I think I've seen too many medical practitioners falter and have to close their practices when they overpromise what they, I think, know at the end of the day they can't deliver. And it's hard to level with yourself as a business owner on maybe what you can't do because you're only one person, which is a big part of why I wanted to expand into this new direction with the parent company that now owns us, is because I want to see more clinics. I want to see more patient models like ours, which, me, myself, and I just couldn't do alone.
Yeah. Yeah, no, that's really, really insightful too. And I think that how do you deal with the emotions associated? I imagine it would be difficult to have a patient that, you really want to see something happen and you see that they really want it, but physically it's not going to come. Do you ever have days when you're just drained, and how do you deal with that?
Yeah, I mean, I think all medical practitioners that really give a little piece of themselves, have a balance in their lives. You can't give up a little piece of yourself to every patient, but there are some patients that are just really medically complex, and you really are in it with them. And that's okay. But you can't probably give of yourself with every patient. You know what I mean? And because there are some people that just aren't able to give 100% in the medical care process of physical therapy because we're asking them to do hard work, really hard work. And so I had a really wonderful Reiki instructor about 5-6 years ago now teach me personally how to do a little bit of boundary work energetically. And I never considered putting energy boundaries between me and my patients because people unload such difficult stuff on us when we're in a session together. That, it became very helpful in my process of growth as a clinician to put this energy boundary up around me that kind of helped me separate myself so I could be present and hold space for my patients who were going through very difficult transformations, but not absorb that negative energy because it will burn you out. There's a high burnout rate in our field, and especially people in the psych world have been really skilled at personal boundary work. And I've been able to learn some techniques from some of my psych friends as well. It's very useful.
Yeah. No, it sounds like it. And I always like to hear about, I personally have done, acupuncture and a little bit of, Reiki and stuff like that. And it definitely, there's a mind body connection that, that's there that can really help with that stress relief, so that's
Sure.
really cool to hear that coming from you. What would you say is kind of like a pitfall that you've learned from, or a mistake that you made that you learned from that's really shaped you and who you are today?
So many mistakes. So many mistakes. I feel like, all of us who are in business for ourselves make so very many mistakes. And I think my biggest mistake was when I just didn't ask for help. I've been sort of always someone who, I'm trying to think of a nice way to say this about myself. I'm very frugal. You know what I mean? Some people would call me cheap, right? So if I had my way, I would do everything myself. I would be the cleaner for my office. I would be my own accountant, my own lawyer, my own electronic health record. And so my biggest pitfall came as I grew. And I was a bit resistant to contracting out for some of my own accounting and for some of my own computer work. And I probably wasted not only, time as a resource, but money as a resource, chasing down correcting the mistakes that I made, in that, area of having to file my own taxes in a certain way for certain counties. where I really should have reached out a little bit sooner than I did on some of those projects. Like doing your own payroll from top to bottom can be challenging. I should have abandoned doing my own payroll many years before I ended up asking for help. So yeah, asking for help was my biggest challenge.
Hmm. Yeah, I think that I'm also learning that too, like I did this exercise where you write down what do you love, what do you hate, and what can you delegate?
Mhm.
Because I'm the same way. I want to do everything and I have a standard, but you can't do everything. So you have to delegate and that's tough.
It is tough, right? And you can't be good at everything either.
Hmm.
Yeah, even if you could create time in a day and an extra hour here and an extra hour there, you have to figure what you're sacrificing. Like, are you sacrificing, I probably sacrifice way too much time with my family and my friends, and you
Hmm.
can't get time back.
Right.
That is gone. It's spent currency. So if I could go back and take some of that time back, I would.
Hmm. So you did mention a few times about the future of synergy and partnering with another company and everything. So tell me what's the future of synergy? What are the big plans that you guys have?
Yeah, I think that partnering with a bigger entity has already allowed us to access some equipment, that brings a higher skill level to our clinicians. And, some of that technology is so cutting edge, you won't find it anywhere, even in the state of Ohio. So it's just so, so cool for my therapist to have access to some biofeedback equipment in the pelvic world that's not only helpful for the patients, but really allows them to hone their skills. But I think it keeps us in underserved communities. I feel strongly that the outpatient physical therapy world, actually outpatient healthcare services in general, are really under a lot of pressure from a reimbursement standpoint from insurance providers. And they really are encouraging patients to receive all of their services under the umbrella of a hospital. But I feel like the outpatient realm is still an environment that's just so conducive to high skilled one-on-one care that I want to keep it going. So I think, the future of physical therapy in general and synergy is to be more locations for us. I'd like to expand us a little bit further west near like Avon, Ohio, Elyria, out that direction, and maybe even a little bit south, closer to Medina. We see quite a few patients from the Medina area in our Berea location, and it's still quite a bit of commute time. So I'd like to reach out into those communities and offer the services that we do that are so specialized in the women's health, sector of physical therapy.
Hmm. Well, I mean in a very exciting vision. I can't wait to see the future of synergy as you take over more parts of Ohio and keep expanding and providing amazing services for all sorts of different people, walks of life. I do have one final question, but before I ask it, I just want to point all the listeners to visit Synergy Physical Therapy and Wellness's website. That's www.synergyptaw.com. And make sure you visit, check it out, give them a call, submit a contact form, spread the word. There's a lot of people who could really benefit from the tremendous services that Dr. Cara and her team are providing. For the last question I want to ask you is a common theme I was hearing throughout your journey as you worked with Mr. Silver and then the gentleman who gave you leased you the building for 2 years is you had people who saw something in you and they took a chance on you, but you also met the opportunity and carried the ball forward. So what advice would you give to somebody who, is in that same position, is young, is driven, is highly skilled? What advice would you give to that younger person to accomplish some of the great things that you have?
You know, my advice is just be in the room. Get into as many rooms as you can. Don't be afraid of the internal dialogue that you may be hearing that tells you that you're too young or too inexperienced to be in whatever room it is. Whether it's just a networking breakfast, which is how I met you, Alex,
Mhm.
or if it's in a boardroom, which is how I met Steve Silver. You are absolutely able to handle the pressure, and young people are really such a source of ambition and talent, that we need them in the room. I can say that as someone who's a little bit further along in this process, and I've been in this field for long enough. I look for those people now, and I guarantee someone is looking for you. You just don't know who yet, but if you walk into that room, all you have to do is be there, and somebody's looking for you.
Awesome. Love that advice. Again, we've been talking with Dr. Cara Ogren here of Synergy Physical Therapy and Wellness. You can visit their website, www.synergyptaw.com. Thank you so much, Cara, for your time. And I really appreciate you being here.
Thanks, Alex. Loved it.
Take care.
Thanks for tuning in to this episode of Alpha Bites. If you found today's insights valuable, be sure to subscribe, leave a review, and share the podcast with your network. Let's keep the conversation going. Connect with us on social media or visit us at alphakeydigital.com/alphabites. Remember, the keys to your digital success are just a bite away. See you next time.